Hello, I'm State Senator George Latimer, and welcome to this special edition of Legislative Report. We've seen perhaps the most controversial and perhaps the most complicated issue take our national politics and local politics in discussion over the last 3 years. Plans that relate to the Affordable Care Act in Washington, also known as Obamacare. And now that we are in the period of time where individuals can enroll in the program, we have to deal with this issue in a very practical day-to-day way, even as our friends in Washington, D.C. are dealing with the overall federal budget. So today on this edition of Legislative Report, I have two neighbors who are also professionals in the National Association of Health Underwriters who will help try to sort through exactly what we face in the implementation of the Affordable Care Act here in New York State. I'm joined today by Mamaroneck resident, good friend Larry Thal, who's the president of Millennium Financial based in Rye Brook, and also Alex Miller, who's a Sound Shore resident and partner in Millennium Medical Solutions, a small employee benefits boutique based in Armonk. I will note that the two Millenniums are not related directly as corporations, but both of you are connected by your professional experience in this area. So thank you both for being with us, Alex and Larry.
Thank you.
So we have, as I said, one of the most complicated pieces of legislation, multiple pages that involve a complete change in the way we do business in obtaining health care. Let's start with an overview of what does this law do to change the way we function in our everyday operations for businesses and for the individuals. Larry?
Okay, thank you, George. The Affordable Care Act was passed back in March 2010, and year by year it's been unrolling. And the biggest change to come now will be January 1st, 2014, where internet portals will open up where individuals and small businesses, for now under 50 full-time equivalents, okay, will be able to go online and seek coverage from a menu of choices. And the main goal being to have more people covered, to resolve the uninsured population dilemma in our country. And to that end, last week marked the beginning of that, Tuesday, October 1st. As it turns out, there were many more people manned in the New York State call center than the bandwidth that was provided by the IT structure that was arranged. So they're making adjustments to that. There have been plenty of delays, but the main advent is that people will be able to undergo a process and submit what's called a streamlined application form, which can actually direct them to other programs, not just these exchanges, not just the individual and the small company exchange, but also to other government programs, state, federal, Medicare, Medicaid, children's insurance, CHIP. So there's all types of benefits that should be coming from this, and I believe they'll probably be forthcoming. But that's your overview. And this year, January 1st, the main thing will be no medical questions are asked. They cannot go by your people. Everyone who applies will be covered and without medical questions asked. No pre-existing condition limitation. That will leave, among other changes as well.
Now, Alex, the broadest brush of this is the creation of state-based exchanges, which I guess I interpret it from a layman's standpoint to be like a farmer's market, where I can go and pick out the produce I like. But as a professional, you've done this for many, many years. Right. What is the functional change that we're experiencing as we move to these exchanges?
Well, thank you, George, for having us. And this, quite honestly, might be the biggest law change that is felt by all Americans since the 1964 Medicare and Social Security expansion. So this really changes everything, the way we afford health insurance, the way we purchase health insurance. And to answer your question, the individual will now be able to afford a health insurance plan, which in New York has been ever elusive. In a state of 19 million people, I believe 17,000 have individual health insurance. The rates are typically double the group marketplace. So by expanding coverage to the individual marketplace, we're hoping that there's going to be more people entering the marketplace. And with that added influx of individuals, hopefully hospital costs will go down. People will not use hospitals as an office visit. There's going to be new ways of buying health insurance. You can go as an individual now and get a subsidy possibly. At the same time, it gets a little more complicated because for businesses, they may have pockets of different sites. They may have an Illinois employee and they want to go on the exchange. It's going to be a lot harder because the networks are a little bit smaller and they're limited to the local area. So that individual would have to buy a local state healthcare plan. But essentially, I think of all the states, I think New York stands to gain the most. They've gotten a lot of subsidy to the tune of $370 million. And I think one particular company got a very large loan as well. So it's very well funded, and we're just hoping for the best, and we're preparing and dealing with a lot of transitionary issues right now.
Now, I gather many Americans get their health care through their place of employment, and of course, some number of them do not. And for those who now have a mandate to do that, how do they interact with the system? This is obviously very complicated. Both of you gentlemen are professionals honed over a number of years, and your skills and understanding this to navigate it. I, the individual, if I'm not part of a corporate environment where my health plan is taking care of my health needs, how do I interact with the system as an individual?
Well, they try to mimic Orbitz. That's been the motto. Sorry for the plug, but they're trying to simplify something that's very, very complex. And a lot of terminologies will have to be made easier, such as things like what's a PPO, acronyms that HSAs that the average person till now has been able to get health insurance through the employer. They may not have had to think about. So the marketplace in New York, it's going to be called NewYorkStateOfHealth.ny.gov, and supposedly you'll be able to select a healthcare plan, look at different options. There's 4 metal plans. There's a platinum, gold, silver, and bronze. And as you move down the metal levels, there's more and more cost shifting. Furthermore, there's additional individual subsidies based on income that can be attached to that. So at the same time, there's no more tax deductions if you go on the individual exchange. So that's going to be something that employers and individuals will have to weigh. Do I get it through my employer? Are my doctors covered? That's the number one question people ask. That's very important. They're trying to simplify it, and it's a very, very tall task. We think it's going to be successful, hopefully, but right now, you could see the state is crashing the website, and throughout the country, into some challenges with delays. But with our relationships, Larry and I are able to help through this process.
Now, Larry, let's take another possible viewer is an owner of a small business. They employ 25 people or so. How do they interact with this system? How do they interact with professionals such as yourselves to navigate through this labyrinth?
Okay. Any group of any size, is going to have pockets of coverage. You're going to have outliers. You're going to have a main cohort that can use a group plan, 1 or 2 choices, maybe 3. And then you're going to have some people who qualify for Medicare, or they have children who are over age 26, or other situations. So what you try to do is understand the organics of that particular group. And it makes it a study of those 25 people, not just 25 people, but I'm just saying. Mm-hmm. So now, in this scenario, 25 is a number that falls under 50, which is what the small shop will take care of, the healthcare exchange for small businesses. So what we try to do is to see if there's anything on there that looks better than off the exchange, Now, there is a tax subsidy involved if the average employee wage falls between $25,000 and $50,000. So if the average wage is above $50,000, the shop exchange wouldn't be used very much, right? Because there's more available off the exchange. In other words, nothing new and amazing is coming on the exchange that wasn't ever off. Now, they all have to be compliant now. They all have to be plans that meet all the measures currently. And I'll just take it and lead you in another direction, is that you do have now pockets where individual employees will have they'll have to come forward with their adjusted gross income. They'll have to this will be part of their personal financial planning. Because as we've seen rates go up 10 to 20% per year, that's more than any mortgage ever goes up.
Right.
So people should be consulting their professional health insurance agent alongside, with their adjusted gross income and various other indicia. People who wouldn't be eligible are people who are incarcerated, or people, there are a couple of categories of people who aren't eligible, but by and large, it's for the whole population.
Now, let's say I'm on Medicare. I'm 65 years of age, older, and eligible for the Medicare program. How does that affect my ability or need to be part of this affordable health care program?
It would not affect it, and that's very important. You continue to qualify for your other federal and state shared programs. Okay, so that's number one concern we have to highlight. Also, in adding to Alex's good portrayal of the plans, there's also a catastrophic plan. So you could actually have a high deductible plan. You have young, healthy people. Part of the economics here is that they need a plethora of young people to fund the people who are going to be claiming. And right now, they've introduced penalties, which are very slight and grow over the years. In 2016, it first becomes several $1,000s, but right now it's a reminder. It's a slap on the wrist. In 2014, $95 penalty or 1% of pay. So they're trying. The success of the program will be people successfully enrolling, and those people obtaining a benefit from that. Sometimes they might enroll thinking it's the next best thing, but unless they've done the calculations, they don't know if dollars and cents wise, a cheaper premium, but higher co-pays and co-insurance along the way and limits, out-of-pocket limits, could exceed the benefit of a lower premium.
Now, and I assume, Alex, the proviso relative to Medicare also applies to Medicaid, to veterans' medical benefits as well.
Right.
If you have those benefits, then you do not have to interact directly with the exchange in these programs.
That's correct. And just to add to what Larry was saying, just to clarify, catastrophic is for under age 30. The whole success of this program is pivotal on the young people coming into the system. They're looking for the programmer, the IT guy who's 27 years old, who thinks he's going to live forever, never gets hurt. They want them to come into the system, but they want to make it affordable. So the catastrophic has a much, much higher deductible, but the rates that we've seen are phenomenal. So just wanted to clarify that. As far as the people that are not eligible for this, not everyone is eligible. You're right, the incarcerated, Native Americans, and illegal residents, anyone who has a permanent resident card, a green card, can enroll and actually are also eligible for the subsidy. And besides for the subsidy, just wanted to also add, there's also there's an additional subsidy on the benefits. So if you're earning below 250th percentile of the federal poverty level, say single earning $28,000, they'll be able to get an additional subsidy on the benefits. So let's say, but it's only for the silver level. The silver plan is about, let's say, the deductible is about $2,000. With the subsidy, additional on top of that might be only half of that. So there's help on both sides once you get into that spectrum. And I just want to add also that, I grew up uninsured in the 80s. Back then, there was no programs like Healthy New York, Child Health Plus. And, you were either going to go on Medicaid or get a really expensive plan. But if you own a building, if you own a home, you couldn't do that. So that feeling stayed with me. So I'm really inspired by the ability to get health insurance for the people that are starting out. There's lots of pockets. You get laid off. You need that little safety net. So this is very promising. But, we're seeing things that the average consumer doesn't see. And we're just hoping it's going to be less politicized and all the stakeholders will be able to participate more.
And just from the standpoint of those young people, it is also possible for them to stay on their parents' plan longer now under this program than previously.
Right. So it's till age 26. And that's been the case already. That's not hitting 2014. That's not the biggest change. The biggest change right now, like Larry said, is January 1, exchanges go into effect. October 1, open enrollment already started. It's going to last till March 31st. You have to enroll by the 15th of the respective month. So if you're enrolling December 16th, you're not going to get January 1. It's going to be February 1. So it's really important to get started now. Earlier the better. Future years, it tightens up. The open enrollment becomes only like 3 months. It's going to be from October to December 15th. And even though there is an individual penalty, which is not that much, $95 for an adult is not a backbreaker, or 1%, whichever is greater. The big problem is that if you think you're going to buy health insurance in the hospital in May and you have no insurance, you need to know that that's not possible. That's adverse selection, and you're going to have to wait till next open enrollment. So the value proposition is not so much the penalty, the carrot and the stick. It's really the carrot. The carrot looks really good, and at least in the first couple of years, we're hoping for the best. So now's the open enrollment period. It's a very, very hectic time. I just want to add also, one of the biggest things that we're contending as a small business is that popular programs like Healthy New York, where the rates are 40% less expensive, they're going away for sole proprietors and individuals. So we have a lot of sole proprietors, and we have actually a lot of corporations that they're renewing, let's say November, December. They have to recertify, and then a month later, their plan gets shut down because it doesn't meet the 10 essential health benefits. So, for example, mental health is not covered, or physical therapy is not covered. So it's not going to meet essential health benefits. It's going to shut down and reopen for January 1. That's a lot of disruption happening at the same time. And much like Larry and other brokers that we work with, we're also contending with Medicare open enrollment. So that's happening at the same time. Maybe that's the intent. Maybe they want to have that easy to understand from their administratively, but from a day-to-day for consumer and for us as brokers, it's really difficult, everything colliding at the same time. And also the general business marketplace renews their policy around December, January. So everything's colliding at the same time. But if our biggest takeaway from today's meeting is start talking to your consultant, look at the information. It's complex. Even though they try to simplify it, it's still a lot of moving parts.
Sure.
And time is of the essence.
And the process really begins, Larry, doesn't it, with you making an assessment of what level of healthcare coverage you think you need based on your situation? Doesn't it become the beginning of this as a self or family analysis of
Yes.
need and expectation?
It's really a financial planning function, right? Because you should look through your checkbook or for the last year or two and see how many people in your members of your family had a big item, medical item. How many people reached that deductible? Do it in conjunction with your agent, because you should be looking at what's now going to be offered. The insurance companies have made changes in their plans too. You have major companies around the country. You've got the Humana and Aetna and Cigna, and mostly United, but United's working it here. Not in the exchanges yet. They're trepid. They're being careful. And I think to that extent, there's not as much competition on the exchanges as there could have been. So prices, even though they're good, Alex, they could even be better if there were more participating competition on the exchange. So I think we're going to see this evolve, but I think it has to start looking in your own checkbook, in your own hearts, your own family. Because again, it's a sum total. It's not just what you pay out each month, it's what you end up paying over the course of the year in co-pays, deductible limits on your co-insurance, and they shouldn't be hidden items. They should be known. It's time to pull out those policies. It doesn't sound like an exciting thing to do, but hopefully your agent can make it interesting.
Yeah, but no, a necessary thing to do. And Alex, as you've already described, both of you described, this being as complicated as it is, it really comes down to the consumer understanding what their choices are.
Right.
And there's a multitude of choices that are out there, and they have to make a determination, don't they? With the advice of a professional, I would suspect.
Yeah, correct. There's about 16 companies on the exchange now. There's about 10 dental companies competing on the exchange. And within those healthcare plan options is non-standard and standard options. So you can have a company that has 3 plans per metal level, or actually 4. That's 16 per company times 16. So as you can see, it starts getting a little bit harried. The first thing is, does my doctor take it? That's really the most important thing. People want to go to their physicians, and that's some of the concerns. We want to have the best doctors. We're in a very expensive area. That's something that's always going to be standard, but we have to recognize at the same time there's a cost for that. And as mature adults, there needs to be discussion on how to fund all this and how is this going to happen. We're concerned about doctors losing their autonomy. About 70% of all physicians are now working for a large hospital system or IPA. Hospitals are going out of business. They're being bought out by larger conglomerates. And, there's a real concern about who's overseeing the antitrust laws. We're not seeing a lot of action that we were hoping for, and it's a big fear. Imagine, having a monopoly on that. Now, if you have one provider for the area, they dictate the cost. So yes, the insurance carrier passes down the cost to us, but that's a line item that they have to, if a hospital wants a 15-20% rate increase, that before they were getting 10%, most insurance companies have to now fall into place. And some of the unintended consequences that we're seeing also is that there's price controls. Healthcare companies now like utility company, like Con Ed, if you will. So if they're getting, in practice, 11.5% of gross profit, healthcare becomes almost like a stepping stone to other items. And so, we're seeing insurance carriers having unintended consequences as well. They're buying up doctors groups, which also presents conflict of interest again.
Right.
So, this is a little troubling, and so it's going to be an evolution. It's going to take maybe like a generation to get this right, but this is a good foundation, and we're just hoping that people are connected, because a lot of this is very confusing to the average person. People don't want to know what happened. They just want to know that their health care
Right.
prices are cheaper. But they really got to get plugged in and connected and part of the conversation, because until the underlying healthcare costs are not addressed, a lot of this is a little bit fluff and politicized information.
Larry, did you want to jump in?
I just wanted to add also, Alex, excellent points, is that I'm a conservative insurance guy, right? I'm not an early adopter, but I have clients who are. Therefore, we're prepared. We're becoming certified on the federal and state exchanges locally. But everyone has to know this now because of, as Alex mentioned, March 31st is the deadline for 2014 for enrollment. So you can't wait till next April 1st to study this. So you might as well get the jump on it and put it side by side with what you have now. One interesting note, the Kaiser Family Foundation studies all this healthcare information, the whole industry, and it's unbiased, pretty good. What they do, they say that 58% of all Americans are covered by employer-based health plans,
Right.
and that should remain the same even at the end of this decade, as the whole ACA, Affordable Care Act, rolled out. So what we're saying, we think it'll just keep shifting and being different, but we don't see companies going ahead and giving up their group health coverage. We see them taking a closer look at what their 25 people, their 10 people, 5 people, 100 people are comprised of. And this is the time to do it. It's not a rollover year. It's a year to examine.
When we look at the effect on small business, I know we only have a few minutes left, and this is a topic that I'm going to ask you gentlemen to come back and sit with me again maybe a few months down the road as we get further into this, because it's going to evolve as we go along. But as you look at the company side, what is the dividing line between a small business, a large business that triggers different types of actions and activities?
You know what? I'm going to start it, and then I know you're going to help me out, all right? But basically, you have to have 2 people eligible at most carriers to have a plan, because now they're putting those one persons into sole proprietorship, and they're going to have to go onto the healthcare exchange. Even a sole proprietor with a spouse now, a major carrier is making, in 2014, they're really one person with a spouse, even if stock of a company is split evenly.
Right.
So then you have 50 people. At 51, you've got a large group now, and that's true under New York state law and under the new Affordable Care Act, but it'll change to 100 people in a year or two. Then it'll be 100 people. That's 2016, Alex.
Right.
So I think those are the key numbers.
We're speaking with Larry Thal, who is president of Millennium Financial based in Rye Brook, and also with Alex Miller, who's partner with Millennium Medical Solutions based in Armonk, 2 separate entities, both evaluating the Affordable Care Act, which has, as we're speaking now in October, just opened the doors for the beginning of the exchange. And as we understand it, this is the period of time for people to do their investigation, and the enrollment period begins January 1st. I'm going to give you, we only have just a few minutes left, I'll give you sort of a closing opportunity to share whatever thought you think is appropriate. And if you would, provide some information about how anyone can reach out to you directly if they'd like to talk with you about the kind of services you provide and any questions, because I'm sure this only begins the questions that folks can have. Alex?
Okay. Again, thanks for having us. I really appreciate this, and I hope this serves the community, because this is, again, one of the biggest law changes since I can remember. And to your point, right now you should be getting your list of doctors. Get familiar with terms like deductibles, co-insurance, because you're going to have to start understanding more and more. But then there's the nuances, the subtle stuff, the soft things that even insurance carriers are right now are not familiar with. And we feel that we're in a great position. Larry and I have been doing this for a long time, and it's the knowledge of the industry, and it's also the relationships that we have. The people that are running some of the key carriers now that are new to the marketplace are former colleagues of mine from Blue Cross. The head of the network that they're leasing, MagnaCare, is a former supervisor I used to work for. So my clients are hopefully going to benefit from this long-time information. But the underbelly of this whole thing really is, again, does my doctor take it, and will they drop me? The good thing is pre-existing is not covered. No maximums on essential health benefits. So people have, hopefully this is going to make our country more competitive, especially in New York State, which has always had the highest amount of health insurance. So this will change things rapidly. But I'm really concerned about the sustainability of this whole act. Our profession has taken a cut about 40% in compensation. We don't charge a commission. The advisory fee is something that we've been reluctant to charge, but the clients that are least likely to afford that are small businesses, individuals, and those are the people that are going to be able to be helped the most by this law. So we're hoping that New York, which probably has the lowest compensation, they left it up to the carrier, but at the same time there's price controls. So that's very confounding. We're taking on much more legislative. We're acting as advisors on tax questions, on legislative. We're wearing many hats. The term health insurance broker is really archaic, and I think 40% of brokers are actually leaving the business. It's just not worth the complication, considering the small return. But I actually enjoy what I do. I like meeting with leading companies here. We have a lot of famous groups, a lot of not famous, but we're a small business. We can relate with what they have to contend with. There's a lot more notices. There's a health insurance exchange notice that was due October 1st. Probably 80% of the people we speak to that are not with us have no clue about this. And Department of Labor will be doing audits. They're estimating $95 billion in penalties will be collected over 10 years to pay for some of the health care bill, which I believe is costing $1.3 trillion now over 10 years. So there's a lot of compliance, there's a lot of issues. I think the small group business marketplace is not just going to disappear. Off the exchange, private exchanges have benefits. The networks are larger. More flexible benefits are available. But again, the individual who's struggling, who's out of work, now they can get an affordable healthcare plan. There is a safety net, and we're really impressed with that. And we think this is going to hopefully head in the right direction. Basically, at the end of the day, this is a very unexciting topic, health insurance. I think Woody Allen said it best. The definition of torture is sitting down with an insurance salesman in the evening. So we're going to try to make this as exciting and as fun as possible, but it's really, I don't know if that's intended for that. It's really about making sure that you're compliant, you're not getting the penalty, getting health care that's affordable and appropriate for your family's needs. Thank you so much.
And legislatively, because we structured this with the executive, the governor, having the discretion to be able to put this into place. We did not put it into hard legislation. We can make certain changes in it as we see how this implements, because we're absolutely sure that there's going to be changes as we go along. And of course, what's happening in Washington could change everything depending on how that gets resolved. Larry, we're going to give you the last word to sort of summarize from your perspective and also provide some information on how people can reach out to you.
Thank you
Just
very
about
much.
a minute or so.
That's okay. Alex, you can tell that we partner up as colleagues due to your fire in your belly, and I just feel that you do everything you can for your clients, as do I. But the vitality and the effort that we bring to this will exceed anything I've done in my 30-year career up till now. I will tell you, it'll be good that the legislature will be able to discuss and flesh out these matters, because as it came into being through executive order from Governor Cuomo, that didn't allow for such discussion in the day. So this is a good thing. I think it's important to add, to be additive to Alex, is that the broker, the agent, the qualified, experienced, licensed professional agent that you have or can be set up with, is an advocate for you, and that person doesn't raise your price. It helps you. It guides you. He guides you. She guides you, and that advocacy is essential right now. So there are going to be ways to find out and reach out in your zip code in your area for the right person for you. Okay. We want to make sure also that you know about.
We only have a second or two, Larry. So
the websites, we'll have posted.
Okay, we'll post some graphics. I think that those who are watching will be able to enjoy. Let me thank you both, Larry Thal, Alex Miller as well, for both of you being here to share some of these thoughts. I'll invite you back so that we can see where we're at a couple months down the road as we get closer to the actual date in which enrollment is going to be structured.
That's great.
Thank you.
I'm State Senator George Latimer. If you want to reach out to our office locally here in the Sound Shore, give us a call at 934-5250. You can reach us on email at latimer@nysenate.gov. Certainly a dynamic issue, difficult, complicated, but very important. Thank you for tuning in. We hope you'll continue to share your thoughts with us directly, and we look forward to seeing you again soon. Thanks for watching. Have a good day.